Have you or any of your loved ones battled and survived cancer before? Or is cancer one of those worries that sometimes keeps you up all night? If you answered in the affirmative to the first question, congratulations! Your worst days are over. To those who answered in the affirmative to the second question, do know you're not alone. In fact, you belong to many, as we will reveal later on. No one deserves to suffer the big C, whether directly or by association. But the moment you do, it pays to make the right decisions. For starters, what treatment should you prioritize? If you lean toward chemotherapy, be informed about a silent epidemic that's hospitalizing many Americans. It's called chemo overdose. In this video, you'll learn about what chemo overdose is. You'll also know about essential preventive measures as well as suitable alternatives. So watch up to the very end so you do not miss any information that might just save your life. Why does chemo overdose happen? BMJ Oncology estimates that in 2024 alone, 2 million Americans will be diagnosed with cancer. That is 0.6% of the entire 300+ million US population. While that number seems inconsequential, it's still enough to scare even the most hardened souls. For starters, cancer treatment is not exactly affordable. We'll tell you the average cost later, so stick around. Meanwhile, let's discuss another potential source of anxiety for you. Not to scare you out of your wits, but to keep you informed. Did you know that chemotherapy has its dangers too? While it's the most accessible cancer treatment out there, chemotherapy has yielded a medical crisis considered a silent epidemic by healthcare professionals. We're talking about chemo overdose, which affects 1 in every 50 cancer patients. It's when chemotherapy treatment attacks healthy cells in the body. That leads to multiple organ failure or, in worst-case scenarios, untimely death. The average cancer treatment costs $150,000. That price doesn't factor in the psychological and mental fatigue the cancer patient and their support system will go through. With these in mind, it's troubling to know that chemo overdose is even a thing. The common causes of chemo overdose include communication issues between healthcare providers, drug interactions, equipment malfunction, misinterpretation of medical records, patient comorbidity, and human error. Yes, the prospect of a chemo overdose sounds scary. However, it's preventable. How, you might ask? Keep watching. What preventive measures are there? When one undergoes chemotherapy, there's already a list of expected side effects. Those include nausea and vomiting, fatigue, anemia, weakened immune system, loss of appetite, changes in bowel movements, mouth sores, nerve damage, skin changes, fertility issues, and the most obvious, hair loss. However, if you suffer from chemo overdose, you might end up with even worse conditions. For perspective, we'll tell you an anecdote about a real-life chemo overdose patient a little later. Meanwhile, let's discuss what must be done to avoid chemo overdose. For starters, there's rigid testing. Physicians need to see if their cancer patients do not lack the specific enzymes required to process certain medications. Additionally, accurate and clear warning labels on medications are of the essence. Knowing the potential dangers of chemotherapy, would you still go for this treatment? Answer yes or no in the comments section and tell us why. So, what happened to the chemo overdose patient we told you about a while ago? Here's Carol Rosen's story in a nutshell. After taking chemo pills in 2021, she went through severe diarrhea and nausea. She also had acute mouth sores that hindered her from speaking and eating. Her liver and kidneys shut down while her skin peeled off. Carol Rosen eventually died not because of cancer per se, but because of chemo overdose. Thankfully, it doesn't have to happen to you or your loved one. There are alternatives to chemotherapy that might prove just as effective, and we'll tell you about them towards the end of the video. Which alternative cancer treatments should you consider? Carol Rosen took the chemotherapy pill called capecitabine. What it eventually did was attack the organs surrounding the area that was supposed to be rid of cancer cells. Another type of chemotherapy known to also cause the same effect is fluorouracil, aka 5-FU. As to why these treatments cause adverse effects instead of curing cancer, the reason lies in the absence of an enzyme called dihydropyrimidine dehydrogenase, or DPD. DPD deficiency, affecting 8% of the population, results in a patient's failure to metabolize certain chemotherapy medications. If you or your loved one is diagnosed with DPD deficiency after a cheek swab or blood test, do not worry. Other cancer treatments exist. Depending on the type of cancer, alternatives include immunotherapy, radiation therapy, hormone therapy, photodynamic therapy, cryotherapy, surgery, and stem cell transplants, among others. Whether you have prior experience with cancer or you dread its introduction to your otherwise smooth-sailing life, we hope that you gained value from this video. If you appreciate what you watched, please give us a like. Don't miss out on the latest health trends and tips. Hit that subscribe button now. Lastly, tell us your thoughts about chemo overdose in the comments section below. Is chemotherapy worth the risk, or are you more inclined to seek out alternatives?